Turkana County, a land of vast horizons, breathtaking beauty, and resilient people. Here, herds of livestock stretch across the plains, a living symbol of wealth, respect, and survival. Tradition runs deep in the colors of the attire, their interactions, and the deep sense of belonging. Yet, beneath this beauty lies a social order defined by patriarchy, where men hold the power to decide. From the migration of herds to the moment a mother seeks care. It is within this balance of culture and change that Turkana's story of health transformation unfolds. Beatrice Nawar, a 21-year-old woman from Kimormor village, is expecting her first child. In Turkana, getting quality maternal care isn't always easy. But today, she heads to a nearby outreach center guided by her community health promoter. Her husband has encouraged her visit, understanding the importance of checking on their baby's health. For decades, cultural practices shape childbirth in Turkana. Midwives like Pauline Kira have found ways to make health facilities culturally sensitive, accommodating squatting positions, respecting placenta rituals, and ensuring babies are named immediately after birth and just before their first breastfeed. These adjustments have encouraged more women to give birth in facilities, combining tradition with safety.
Another reason that was making them not to deliver in the facility is cultural belief. They believe on taking their placentas back home. So when we talk to them that it is possible, some say, I go and deliver at the facility and my placenta is disposed, I will not go there. So we tell them, if you deliver in the facility and you need your placenta, we shall pack it for you and you go back with it. Okay, position of delivery. They normally prefer squatting because they have been delivering at home in the previous deliveries. Now they are in the facility, they want to squat. We allow them. So what we do is just take that Macintosh and spread on the floor, then allow the mother to squat there and deliver. We also have a holding method that is there because normally they feel comfortable when they hold somewhere and push. So in the maternity there we have a method, delivery method we have fixed on the wall. So if she feels like holding it, pushing, it's okay. Mine is just to wait for the baby, no other problem. At times they say naming of the child. A baby is born, then they say this baby cannot be breastfed until they name the child. According to our tradition also, or our routine, we say a baby needs to be breastfed within 1 hour. So normally, before she delivers, we inquire first. Are you going to name the baby before breastfeeding? If she says yes, then we tell her, okay, get your relatives to be around so that immediately after you deliver, we name the baby and breastfeed.
By working with mothers, elders, and traditional birth attendants, midwives have adapted healthcare to respect Turkana culture, from allowing preferred birth positions to returning the placenta to the family. These culturally sensitive approaches have built trust, encouraging more women to seek skilled care. The results are visible. Over a decade, Turkana's maternal mortality has fallen dramatically.
We have been able to improve from 1594 per 100,000 live birth to just 381 per 100 live birth. This is just way above the national average of 345.
When this program did start, we started at a baseline of about 54 skilled birth attendants. But currently we are talking of close to about 70%. This is an achievement.
Turkana County has embraced the Kimormor model, which promotes One Health by integrating human and animal healthcare. About 62% of the population are pure pastoralists, while 12% are agro-pastoralists. Together, they make up nearly 88% of the county's 1.1 million people. Only a small fraction, around 8%, are engaged in formal employment, highlighting the importance of outreach services tailored to pastoral communities.
Nisorok is the youth.
Anthony Arasio, the technical lead for maternal, newborn, child health, and adolescent health at AMREF, explains that outreach programs like Kimormor bring healthcare directly to the communities using traditional Turkana gatherings to deliver human, animal, and public health services together. By involving elders, mothers, and youth, these initiatives have built trust and ownership, encouraging families to seek care even during migration.
One, they say, involve us, our leaders. Bring the people we call the Oloibons, the Nimrok, in this table-making space. Bring our traditional birth attendants. Bring these mothers who are pregnant. Let's have a conversation with men so that we agree how are we going to support uptake of maternal health services in our context. So after having that discussion, we said now it is very clear that you have realized why it is important for these mothers to come to the facilities.
Across Turkana, this approach is changing lives. From remote kraals to established villages, mothers now have access to health services without abandoning their culture or daily routines. In a Maniko village close to the Ugandan border, this father is taking the lead, bringing his family to the Kimormor outreach just a few meters from their home. Previously, accessing healthcare meant long, exhausting journeys to Oropoi. But today, with services nearby, he ensures his children are vaccinated and receive health checkups.
Rai palimala dagitar kwadrobola vakanaria dewa kidu Oropoi. Dalo de kagnur kokon. Goko kana yara Oropoi. Haf jambe jatamate dewa. Na kwarne ramagnire chadare karre tolnere dewa. Menari tuang rongna de kala kakara karre aluzi ortoni ko yani genio de kalorot. Agrona kaya artungi vimuna. Na bunye dewa diene aja ekethenga rongna.
In villages like Natira, community health promoters are the bridge between health services and the people. Cecilia knows this firsthand, having delivered her first child at home amid life-threatening complications.
Kitambo wamama walikuwa wanajifungulia nyumbani. Hata mimi mwenyewe mtoto yangu ya kwanza nilijifungulia nyumbani. Ilikuwa ni 2013. Kwa sababu sikuwa najua umuhimu ya hospitali, ni nini unasaidiwa, ni nini unashughulikiwa, lakini sasa mimi niko na watoto 5, watoto wangu 4 wote nimejifungulia hospitali. Na wakati ya kitambo hiyo yenye nilijifungulia nyumbani, nilipata mashida.
Now, trained as a CHP, she visits 52 households, ensuring mothers attend clinics, know danger signs, and come up with birth plans together. She also provides support for child nutrition and hygiene.
Naangalia pia wamama kama wameanzisha clinic mapema. Immediately kama wameshagundua wako na mimba. Kitu kingine pia nahakikisha huyo mama wakati anapoenda clinic amerudi at least mara 8. Kitu kingine pia ni kwamba kwa huyu mama mjamzito wakati anafikia karibu na kujifungua, huwa anafunza huyo mama maneno ya birth plan. Yaani kujipanga kwa kujifungua kwake.
Her guidance has transformed practices. Every mother under her care now delivers in a facility.
Wamama wangu huwa na wahimiza kabla hajajifungua, anytime ukipatwa na uchungu ama shida, hospitali iko hapa karibu. Ukienda ukipata hospitali iko karibu, daktari hayuko, unaenda tena kwingine hospitali nyingine.
In pastoral communities, reaching women and children starts with engaging men and kraal leaders. By tracking families on the move with their livestock, they ensure that essential health services reach mothers and children wherever they settle.
And that's why you will hear approaches such as Tree of Men, where we discuss with men to ensure that they do inform us on what is happening and where they are moving next. We have kraal leaders who do inform us on their plans, where they are going next, so that when we are doing the outreaches, we go exactly to where they are.
Over the past decade, in addition to the rise in skilled birth attendants, Turkana's health worker capacity has grown, ensuring more trained staff are available at facilities. Together, these improvements after antenatal care to monitoring during delivery are helping to reduce maternal and newborn deaths, with all facilities now reviewing maternal and perinatal deaths to improve outcomes.
With the number of ANC clients that we are seeing who have been referred from the community with the community health promoters, it is really assisting, and it is also promoting the number of mothers that we are receiving for deliveries. And therefore, it has reduced the maternal deaths and the perinatal deaths.
So we have put surveillance structures in place. Any death that occurs, we do a mortality audit, and we ensure that we learn from the findings of that audit.
The Kimormor approach, also globally known as the One Health model, brings human and animal health services together. Turkana, Kenya's largest county by land area, spanning over 77,000 square kilometers, is home to a largely pastoral population. With more than 70% of residents relying on livestock, health solutions here have been uniquely customized to the Turkana way of life.
When we are offering our services, first we have to understand our population. Our populations is a pastoral nomadic population, and so that means their priority is the animals. So they keep on moving from one area to another. That's why we are saying we are targeting the animals, which is their priority, as we give them their healthcare services.
Even in constant movement, families are connected to healthcare.
Agrone be yonga dagit. Within edwa malin kalnon. Ane anangeten kalnon. Go na tang barne kara yeleke. Managini edwa katgone adi. Managini ade mene adim. Manari adi milo dagatarea. Patu boja toyo to tania ni ade kai. Mito wa mali alo to mi bare do mam do na ngere kara ya yolo ile engara ko boji adi mi ngene mito iriya moto boji abi gibi aloro.
And when emergencies arise, the Tree of Men coordinates rapid response, contributing funds, alerting local leaders, and sometimes even escorting mothers to facilities.
Hele buno do angro ngwa wana rabero toyo muna ipore parazike yene ye to yala rai odi kuwa kare abero na nyikimi arake ngara kama edelu chigida ngakro ko da do wanguna edi ariya ko du kwa kangi to do wanga ber acha wanare ya wuto amo to warno ta chaka kana to ale odi kuwa ko tananga ne ye be tarlo apolo wa kana ka rupi ya to lo dio yala rai parade bo ariya ko du kwa kangi to ngaber ko ngi aja kan tu Kimormor ani yana una rekana mari ko na kolong ani be ya ya Kimormor ko na pas be bala be ya ga pande dane ye de wang de dane la ngakemak la inyo la ngaparen atam te ko jo ko boren be Kimormor aya ngakur da na pas ye kita rapai be yo ya ni bore panya gne ra ga pande ya tu ke ya lo ya tener lo biar kepala beko joko bor Kimormor kelakar adu angkat ku atamadi beko joko bor na mori punya bor angara tangkinu tuan poi mere ko tenda.
Nakadio was previously a traditional birth attendant delivering at home. She is now a birth companion, working with mothers to clinics and supporting skilled care.
Na bako ngena aria buato ria machi dala polonia lokdia mga ber na betaswa. Toria bagini aka beru apa toria tanyara ku jing kitetiodan atama kuju ngarakna itu ane ni ko terre borra ko ke kangaria munia cheda.
Her message is simple: no woman should die giving birth, and every mother's life matters, Turkana or South Sudanese alike.
Karaya santi sana ko terre ngakorna kala kanguna dangi ko terre aja bukola ngator gora ke sudoni ngabaru aria munia cheda atatapa
atoriamu narono ayariti alwa ayariti ala sebetari ama mna bangi chandro bodu arko bodu ayam na bara makan to kana ko terakri mario mana ko ari kana ngatopo sada kisakutu ata mare to longolongo kai ala sebetari kwasi kreto adang twani penga da shabun.
In Nadapal, at the border of South Sudan, access to healthcare was once a 40-kilometer journey to Lokichogio. Pregnant women faced severe delays, sometimes transported by donkeys. Today, the Kimormor initiative brings services directly to the community.
Na jakoro bo abunio betar gona mera ka tatama ngoni tatami ngoni ka tamari ay ngotunga dalo lo potio to chamata yara lu kikyo anto konna na chakunya kuja chakunya betar lo ka bunio kona akoro sidana buna tarong bang chan wegotola wegida tolo betar.
In remote parts of Turkana, the line between human and animal health often blurs. Moses Nyakalale is a community disease reporter, a crucial link in Turkana's Kimormor model. His work begins long before the doctors arrive. Every visit to treat livestock is also a chance to look out for families in need.
Tuko joint na watu wanaitwa CHF community health promoters. Wakati hao kama mimi mtu ya wanyama ninafika ndani zaidi ya wao. Nikipata magonjwa ya watu ama nikipata kuna wamama wajawazito, kama tuna magari zetu ya veterinary wamefika huko, tunawasaidia kurifaa ama kuwabeba hadi mahali ambapo wanahitaji kusaidika. Alafu nikirudi huko kuna kitu yao inaitwa outreach. Kwa outreach yao nasema wakati fulani tulipokuwa tukienda kutibu wanyama tulipata wamama wajawazito mahali fulani, watoto ambao wako malnourished ambaye wameathirika sana wanapata kusaidika.
In Turkana, traditions that once kept mothers away from hospitals are now helping bring them closer. Kimormor ensures care moves with the people, reaching mothers where they live. Men, elders, and health workers stand together to protect life. Hope is growing in Turkana County. One mother, one child, one outreach at a time. For Willow Stories, I am Sarah Kamande.